95% of older adults live in their home, and that's where they want to stay. That's where they feel comfortable. And nowadays, that's where they're expecting services to be.
One of the prime reasons why we see people in a house calls program is actually because their family doesn't want them to go to a nursing home setting or doesn't want them to go to the hospital.
And so we really fit into that request by bringing medical services to the home environment. Hi, Mrs. Marcinic. This is Dr. DeGolia. All right, be there in a few minutes. For the vast majority of patients that we care for that are in our house calls program, they are either bedbound or have significant restrictions on their mobility, are disabled to the point where getting out of the home is not something that's done frequently or easily, that it requires significantly more effort to get out of the home than is otherwise reasonable. Hi. And you're up and moving. This is fantastic.
Yeah, that's good.
This is the best I've seen him.
You know, he doesn't have those hiccups no more, so maybe I shouldn't give him that medication anymore.
Or maybe he doesn't have the hiccups because he's gotten the medication.
Well, I mean, yeah, it could be that way.
Sure.
Too, you know.
Let's go over that.
Yeah.
I can see how they live in their home environment. I can see how they function. They're more relaxed, so I can actually not only perform a better exam, they tend to be more cooperative. We're controlling his heart failure.
His blood pressure, right?
His blood pressure,
and
his reflux disease from his stomach, and so that's working out well.
Yeah.
Yep.
I'm glad, you know, because even if I have a lot of work with him, but I still like to have him around, you know.
By going into the home, you can meet the caregiver. And the other thing is that you can see the home. And you can kind of get a sense of how healthy the environment is. You can open up the refrigerator to see what they've got inside. You can look in cupboards and so on and so forth and really get a sense of what the home environment is like.
Our House Calls program is a very special program within the Department of Family Medicine. The program really functions to help people who really can't get to the doctor's office. It is a throwback to the old days when the doctors used to come and visit you. What a wonderful opportunity to educate our residents and medical students about where people live, how they live, and the challenges they face with chronic illnesses.
The past 2 years, we've taken every single first-year medical student at Case School of Medicine out on a house call visit. Is an eye-opening experience.
Well, it's why right?
Yeah.
I was on a ride along with Peter
Right.
in my residency, and after doing this, I'm like, this is great. This is really good. This really addresses a lot of the problems that I have with managing my elderly patients in the office. And right after the ride along, I said, basically, are you hiring?
Yeah,
I'm graduating.
That's right.
And so I got paired up with Dr. DeGolia for, I think, 3 to 4 months, and I would ride around with him on his house calls 1 or 2 times a week and spend the whole day with him, pretty much. It's tough because as medical students, we kind of like overwhelmed with medicine and, practicing it, and we think it's amazing, and we want to, do all these things that we hear about. But then once you see what patients' lives are like sometimes, and you see that the person, has to take 4 buses to get to the Walmart to get the prescriptions, and you see, the difficulties they have head on, you, I think, generally lose that sort of attitude and start appreciating, the barriers that patients have and the difficulties they have. I think it definitely opens your eyes to becoming a truer, compassionate person rather than just, our ideas of compassion once you see a person's real life.
And so a big change that's happening in our society is residential housing with services. And we fit into that to that need because we're part of the service spectrum by providing medical services in the home environment.
Our whole goal is to support individuals in the community, in their own home, for as long as possible, and actually to avert altogether, if possible, having to ever go into an institution. That's really the goal. And without house calls, many people would not have that choice.
Tony, good to see you, sir. Glad you're doing
and-
so
and-
well.
And just a nice thank you to the doctor.
Yep. Good. All right. I will plan on seeing him again in about a month's time.
Yeah, okay.
Sooner if there's a problem.
Yeah.
Well, I chair an organization called the Council on Older Persons. One of the principal goals is to enable older people to stay in their homes longer. And so there's a real emphasis on home and community-based care for older people, and certainly the house call programs fits into that very nicely.
And one of our major programs is dealing with the health impact of inner-city housing, particularly ones that have not been well maintained and deteriorated. So we have a programmed inspection process, inside the house, outside the house. It starts as a home medical visit, so that Dr. DeGolia or one of his other physicians is there to get the process started, to introduce the home environment inspection team to not only the patient, but the caregiver. There's a real team approach to it.
I see a lot more medications than you would think a person is taking, certainly than they would tell me they're taking if they come directly to the office. We'll probably see that today we will see stacks of medication or, medication sort of here and there in a house. And sometimes they're taking them, sometimes they're not. Sometimes they're taking them only if they think they need to take them. I mean, it's a whole gamut. Hello? How are you doing?
Because I'm alive.
Because you're alive.
I'm alive.
You're alive and kicking.
That's right. I'm kicking, but I'm not kicking high.
No?
Well, seniors typically will self-report that they do very well. Somebody with high functioning skills will say yes and appear very cognitively intact in the office visit, but when you go to the home, you're seeing a different side of it. It's not that they're not telling you the truth, but they're, because of shame or guilt, they want to protect their independence. So they're going to not tell you sometimes because they don't want to end up in a nursing home.
Particularly the first visit takes a lot more time, partly because it's at that visit that I'm really scouring the apartment to see if there are other medications they're not telling me about. Almost always there is. So let's go over your medications and see exactly what you're taking. Can you show me all your medications? You've got medications all over. You've got
medication
in
all
your
upstairs.
cabinet, you've got some here, you've got a bottle over there.
Well, some of that's my wife.
Okay.
I got all this stuff
So
here.
where's all your medications? Being able to assess medications and help with medication management is much easier from a home visit than from an office-based visit, actually. You're a little pharmacy.
Yeah. Let me get that bottle out of here now.
Yeah. You still have a couple more bottles back there.
I'll plenty of bottles, but them what I don't take.
Okay.
This is another one here. That's the way this goes. That.
Okay, these are the same. Usually patients come to our office and present to us on our terms, on the doctor's term. They're in the doctor's turf, and they basically do as we ask. We set the rules, and they follow the rules we've set for all practical purposes. But in home visiting, that's reversed, and I am the guest, and I follow their rules. So if he tells me, I really want you to take your shoes off, I take my shoes off.